Well, the FDA plans to allow, older and immunocompromised Americans to get a second updated COVID booster shot in the near future.
And here to tell us what this means is Dr. Jeff Pothof, Chief Quality Officer at UW Health. Welcome back.
Hey guys, how are you doing?
So this booster is not FDA approved yet, but why are we talking about this now?
Yes, what the FDA is trying to figure out is we know that after immunization, over time, that protection wanes. And folks who are older or immunocompromised, their immune systems wane even more quickly than, say, regular folks like ourselves. So they're trying to figure out what's the timing to give another booster to those folks who are vulnerable that will protect them against severe disease, but not necessarily give it too soon where it doesn't offer any benefit from the vaccine that they got in September. So I think they're thinking about 4 months after that, September 1, so any time here now, they might offer that to people who are over the age of 65 and are immunocompromised. So nothing official yet, but in the next couple weeks we might hear something.
Let's talk about long COVID. There's 30 million people that have long COVID, 7 million people disabled because of it.
Yeah, I mean, we hear almost daily different stories, medical studies on the effects of long COVID, whether it's, brain fog. Now they're talking about sleep disturbances. A lot of people are affected by it. 30 million is a lot of people, 7 million enough where it's kind of really impacting their day-to-day life. And yet we don't know everything there is to know about long COVID. So I think over the next couple of years, we're going to learn more and more and hopefully try to figure out how do we alleviate some of these symptoms that so many people are suffering from.
How are some of these people becoming disabled from this?
I think when we talk about disabled, it's usually the symptoms are severe enough where it is not allowing them to go to work, lead a normal life, and they're actually trying to claim disability because they just can't do what they were doing before they had COVID and then developed these long haul symptoms.
Is there anything you can do to help not get long COVID? Like,
yeah.
Take any treatment while you're sick?
So not so much. We do know that people who are vaccinated or have a milder case typically have less severe long COVID, but not to the rule. The best thing to do is to try not get COVID, but at the same time, I mean, that's nearly an impossible thing to do in today's world.
All right, so we got this gorgeous spring day and things are starting to bloom. So are the allergies. What are you seeing?
Yeah, so I think there's a lot of people that say, you know what, when I was a kid, like, yeah, there were allergies, but like they weren't this bad. And now it seems like allergies are much worse. And there's some new studies that suggest that those people are right. So as our world is getting warmer, plants are starting to bloom earlier. So we're seeing about 20 days added on to the start of allergy season that didn't used to be there. And frost is coming later. So we're seeing about 10 more days at the end of allergy season. And then just to throw some fuel on the fire, carbon dioxide, which is at an increased level in the environment, is kind of like the equivalent of our oxygen. So the plants are able to do better. They emit more pollen. So we've got about 20% more pollen out there during this season. So if you're an allergy sufferer and you're like, man, these last few years just seem like they're not very good, you're absolutely right. They've been a little bit worse.
Interesting.
So start your protocol earlier if you are on something.
Yeah, I think, I didn't used to think of allergies until, at least mid to late April. And now we see people end of March sometimes coming in with allergy-like symptoms, itchy, scratchy throat, itchy eyes, things like that.
And plants are now growing where they didn't used to. They're moving further north.
Right, because our zones are starting to change as the climate changes. These plants that maybe would have been farther south are doing a little bit better farther north.
All right.
Lucky us.
Doctor, good to see you as always.
Same.
See you next week.